Coming up next on Primary Care, I talked to the program director at Gift of Life, Remonia Chapman, about the myths surrounding organ donation.
People thinking, well, I'm too old, I'm too sick, I have this disease and that disease, and there's no age limit on organ and tissue donation.
Hello, and welcome to Primary Care. I'm your host, Dr. Lonnie Joe. Did you know that every 10 minutes, a new name is added to the more than 120,000 people on the National Organ Transplant waiting list? And every day, 22 people will die waiting for those transplants. No group knows the anguish of this more than minorities. It's true that minorities are less likely to receive organ transplants, but not for the reasons that you may think. Here to provide us with the facts about organ donation and dispel the myths is Remonia Chapman. Remonia is the program director for the Gift of Life Minority Organ Transplant Tissue Education Program, known as MOTEP. Remonia, welcome to the show. Thank you so much for joining us.
Thank you, Dr. Joe. It's a pleasure to be here.
One of the main reasons, Remonia, that I wanted to do this show and to highlight this whole subject about minorities receiving and becoming transplant donors is because it is not talked about enough in our community, and it shows in our numbers. The Black community has a need that is greater than any other in this arena that we know of. However, we don't talk about it and we don't donate. Why is that?
We don't donate and talk about it because we just have a historical perspective about organ and tissue donation that is not a healthy one. And definitely there's some historical things that happened a long time ago, and so as a result of that, people hold on to those myths and misconceptions. They feel like if they sign up on the Michigan Organ Donor Registry and get to the hospital, they're going to try to take their kidneys, you're not going to try to save their lives. We don't trust the healthcare profession because of different things that have occurred. But we found out that probably one of the biggest reasons that people really had not been coming into our communities talking about the need for organ and tissue donation.
So it was an education issue.
It was an education issue, really, and still with that education mission, there's still sometimes challenges because of all of the myths and misconceptions, the healthcare disparities, people feeling as though they're not getting proper health care on the front end and then wanting to be altruistic on the back end. So once we realize that we've been able to marry that message to the need of people with diabetes and high blood pressure, the two leading causes that the African American community needs transplants, we've seen those numbers go up. Unfortunately, not to the need rate, but we have seen them increase.
So there are other issues around transplant and donation, religious beliefs, yes, age, illness, racism. Those all affect the attitudes that we see exist in the minority community in terms of donation.
Definitely so. That, again, this whole concept of, that if I give up my organs, they will go to people that don't look like me, people that are rich and have resources, and so those persons that look like me will not get those organs. And so therefore having persons that have received organ transplants get out and really kind of help us tell the message and become the living testimonials that people like to see about organ and tissue donation really began to make a difference. Again, people thinking, well, I'm too old, I'm too sick, I have this disease and that disease, and there's no age limit on organ and tissue donation. There's no disease that prevents you from signing up. At the time of your death, we will do evaluation to see if you can become an organ and tissue donor. But again, we just have realized that because we have not really gone into the communities as much and really talked about this subject matter and made it a really personal subject matter, that sometimes people have still been somewhat reluctant to sign up.
Can the church community help in this effort? Legacy reports that I'm going to go back to the Lord with everything that I entered in the world with. What are we doing about spreading this word in the religious community?
Again, you're right, that was one of the myths and misconceptions. And so we have an Angels for Life program of where we have 3 ministers who are all organ transplant recipients.
Really?
One deacon, yes.
They're recipients.
They're all recipients. One deacon who is also a recipient that has been, going out. We've done public service announcements, to get that message out, to let people know that, here are people in the faith community that need. We're also trying to get other persons that are in the faith community to talk about it. We know that there are people who need organs in the faith community that are somewhat reluctant to share with their congregations that they need an organ, and that they can definitely sign up to become an organ tissue donor. So we have Angels for Life Sundays where we go to churches and we go to different mosques and temples to sign people up. We have National Donor Sabbath Weekend where we do a concert every year, again, to try to make sure that the message is getting out in a way through music, through testimonials, that people don't feel so threatened, that they can talk to people about and they can hear about it. And so just constantly getting that message more and more out into our faith communities.
Help our viewing audience understand a little bit about the types of organ donations that occur. What are the most popular, not popular, but what are the most common, the ones that might have some limitations in terms of being difficult for our community to understand and to get involved in? If you start talking about transplanting my heart, it takes a different tone as opposed to transplanting my kidney. Okay, talk to us about how we respond to that.
You are correct. Well, our greatest need is kidneys. 46% of the people in Michigan need kidney transplants. And with kidneys, because we match them by antigens, 3 from your mother, 3 from your father, you usually get your best match from someone that is usually in your family. But because of diseases such as high blood pressure and diabetes, rather than many times people being able to get a living donor from one of their relatives, it kind of becomes a screening for hypertension and diabetes. And so therefore, if you're not able to get an organ from someone in your family, the next thing is your ethnic community. And so you'll get a greater match with persons that are in the ethnic community. And so that's why MOTEP was started, to make sure that we could increase those persons in various ethnic communities signing up to become organ and tissue donors.
Tell us about how the numbers look. How many African Americans in this country are waiting for an organ?
Of that 120,000 people that are waiting, 85,000 of those persons are waiting for kidneys. And of that, 35% of them are African American. The next highest organ that African Americans are waiting for are heart transplants, and then liver transplants. Again, you also asked me about what organs can people give. While they're still alive, you can donate a kidney. You can donate part of your liver. The first adult-to-adult living liver transplant occurred here in the state of Michigan, and so amongst an African American woman and her daughter. And so that's something that, once again, we need to make sure those messages are getting out.
So you don't have to die to be a donor.
You don't have to die to be a donor.
You can actually assist with these efforts. I know at the celebration in California that my family attended, we ran across a young lady who had donated part of her liver twice and was volunteering to do it a third time. That would be 3 people that she did not know. There were no relatives involved. She felt that so strongly about organ donation that she felt that she could contribute in this way. That's a major sacrifice.
That's a major sacrifice and a wonderful story, because again, as we talk about the faith community, we are so designed to give. And we know that when people donate a part of their liver, within 30 days, their liver has regenerated to 90%. And so again, for those of us who believe in faith and talk about faith, that it's a wonderful opportunity for us to exercise that faith.
So I'm a doctor. What should doctors, me, my colleagues, what should we be telling patients that we see every day with all these disease states? How should we insert this organ donation message into our conversation?
I think because you're a trusted person that people come, we trust our physicians. And so just having that conversation, just like we talk about advanced directives and what people want to do, that, having it in a conversation where people are not in a crisis mode, to let them know that they can talk to their families about it, to let them know the importance. And again, everybody will know someone in their family, in their church, in the community that is in need of an organ transplant. We all know someone that is on dialysis. There are more dialysis centers now in the city of Detroit than there are at McDonald's. And so therefore, there's an opportunity for us, for physicians to introduce the conversation in a non-threatening way, to have materials in your office, to have brochures in your office, to participate in different activities that we have. We have a blue and green day that we just ask people to kind of wear blue and green, our Donate Life colors.
We're going to take a short break. More primary care when we return.
My name is Blake. I received a heart transplant when I was 2 weeks old. I play defense for the Red Hot Tornadoes. The best part about playing soccer is that I get to run around and have fun. Just because I had a heart transplant, I don't expect people to take it easy on me. I can still do anything they can do. Sometimes my heart starts pounding like faster and faster as I go. I know I have someone else's heart inside me. It makes me feel happy because someone was generous enough to give me a second chance to live. I feel like it's my responsibility to live each day to the fullest. And the thing I look forward to the most is having my own family.
This gift of life was made possible by an organ donor. Imagine what you could make possible. Learn more and sign up as an organ, eye, and tissue donor. Go to organdonor.gov.
We women sure know a lot of numbers by heart. But do you know the most critical numbers for your heart health? That knowledge could save your life. Do you know your numbers? Talk to your healthcare provider today to learn your health numbers. Your heart depends on it.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just
Please, don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
We're here with Remonia Chapman, the director of Gift of Life MOTEP, the Michigan Organ Tissue Transplant Education Program. Remonia, you've been doing this for quite some time now.
Yes.
And in your travels, I'm sure that you've gotten an impression as to why people, even those who've received transplants, don't talk about it.
They don't talk about it because, again, I think in our community there's just a stigma associated sometimes with, people being sick or people perceiving that people are sick or doing something different. And because people are somewhat unsure about how people are going to respond to them, they choose not to. We've had families that have been donor families that didn't want other people in their family to know. And then at the other times, we've had persons now that are beginning to share those stories more publicly, put that information out in the community. And so I think once we get over some of those myths of, don't tell anybody that this person is sick. Don't tell them that they're on dialysis. Don't tell them that they're this and that. And we began to get over those myths because, again, those are the secrets that are killing us. So people don't know that there are members in your family that, die from diabetes or kidney failure. And so we don't tell them. And so as a result of it, they don't know, they don't respond to the symptoms. And by the time that they do respond, unfortunately, they're at end-stage organ failure.
Tell us about this campaign of organ donation amongst African Americans, the development of MOTEP, which is just a phenomenal organization that you've put together here and sheltered through all of the ups and downs of this whole discussion of organ donation. Tell us about the history of that.
Well, MOTEP was founded 25 years ago by Dr. Clive Callender, a leading transplant surgeon at Howard University. And the conversation and the founding of MOTEP began with a simple question. That is, why did people need at such great rates, but minority communities were, giving at such low rates? And so as a result of that, he did focus groups in the Washington, D.C. area and came up with 5 reasons. Again, the mistrust of the healthcare system, racism, fear of premature death, people's religious beliefs, and again, because people were not coming into the community. And so MOTEP came to Michigan in 1995. And even though I was not the first person that started with MOTEP, I have been there now, will almost be 20 years. And I always tell people I wasn't the first, but I was the best. And I was the one that was able to come in and to really just embrace this concept. Because the wonderful thing about the MOTEP models, it talked about not only people needing transplant, but trying to prevent transplantation. And so the mission of National MOTEP is to reduce the amount of ethnic minorities, needing transplants. And so marrying that message of letting people know that we were committed to their health on the front end, as well as that they had an opportunity to save lives on the back end. And it has just been a fantastic career. It's a career where I believe that the three disciplines of my life have come together: spirituality, science, and education. And so I'm blessed every day to do what I love to do.
That's a great combination. MOTEP has a walk every year here in Detroit that my wife and I have participated in. You know our story well in terms of the loss of our daughter. Is that something that's duplicated across the country?
There are various walks across the country. Many of them are much larger than our walk, but I don't think any of them are any more meaningful than our walk. And I do have to say I want to thank you and your wife again for not only participating in our walk, but having the Detroit Tigers participate, and that our Circle of Life Gardens named after your daughter. And so we are very, very proud that you have allowed us to be a steward of the legacy of your daughter.
In November of 2010, I lost my daughter. She was 38 years old and she died of an asthma attack.
Almost 21 years ago, after playing professional football with the Tampa Bay Buccaneers, I was told that I needed a kidney transplant.
A very close friend of mine, they were an organ donor. When you lose someone, there's something meaningful to know that their life continues on through the lives of others.
I do know through the Lions Club of Philadelphia that there is a person who received her corneas and can see now.
I'm very blessed and fortunate to be alive today, and it's just a tremendous experience to know that somebody gave their life so that I could have mine.
We are here in beautiful Belle Isle. Over there is the great city of Detroit. 40% of all the patients who are waiting for a life-saving organ transplant live in that city.
Today we are having Life Walk, which is a walk-run, 5K, 10K walk-run that is really about, again, raising awareness.
You can't have a transplant unless you have a donor. And so the best way to have a donation is for individuals to register to become a donor.
The people that you're going to help are going to be your neighbors, your family. You have so many people with kidney disease in the Detroit area that if people in the Detroit area do not donate, those people are going to have to wait a lot longer or die on the waiting list. So you'll definitely be helping the people directly on your block in your city.
She was a registered organ donor, so knowing that that was already her wish, it was easy for me to accept that. Since that time, I've not only accepted it, I've promoted, I supported, and knowing a little bit about transplantation through working with MOTEP, I've just gotten more and more involved.
MOTEP, Minority Organ Tissue Transplant Education Program. MOTEP is a community organization that has been instrumental in increasing organ donation for minority communities. For 18 years, we have seen the dynamics go from a very small group of people who came out during the first walk, I think it was 20 of us, to now what we're expecting to be several thousand. We have donor families here, we have recipients here, we have supporters, caregivers, and people who just are really excited about making a difference in the lives of others.
Last year, Gifted Life Michigan coordinated the transplants of nearly 1,000 patients. To put that in perspective, every transplant typically lasts around 20 years, and 20,000 years of life will occur. And think about that, 20,000 birthdays, 20,000 graduations, 20,000 weddings, just in 1 year.
4 years ago in Michigan, just 27% of the people were registered on the Gift of Life Registry. And I'm so happy to announce today that 52% of adults are registered on the Organ Donor Registry.
Anyone who's out there who's considering organ and tissue donation, I would say to them that think about others, think about life, think about yourself. If you were in that position and you need it, would you want someone to give to you? So if you are man enough or woman enough to be accepting, you need to be man and woman enough to be giving. So it's about giving. It's not about anything taken or anybody trying to deceive you. It's about giving the best gift that you can give, and that's the gift of life.
Stay with us. More primary care when we return.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Chris Domine is a husband, father, an athlete, even an Ironman. But 10 years ago, Chris's kidneys were failing.
The doctor said if you don't do dialysis, if you don't get a kidney transplant, you are going to die.
Then Chris received a second chance, made possible by an organ donor.
Your well-being changes from loss of hope to better times ahead.
Imagine what you could make possible. Learn more and sign up as an organ, eye, and tissue donor. Go to organdonor.gov.
These 4 local church leaders have been given a gift. He received a liver in 2012, a kidney in 2010, 2 lungs in 1997, a kidney in 2013. They are organ transplant recipients.
The quality of life that I had before the transplant, it was so diminished. I didn't know where I was going to live.
If I wanted to live at a high quality of life, my best case scenario was getting a transplant.
And my life goes on, but so does my donor. My donor lives on in me, and they live on beyond, and so that's the gift of life.
I feel that I'm on a mission now that I'm a recipient to encourage and inspire everyone I meet to become a donor and give the gift of life.
Be an angel for life. To sign up or hear the extended discussion, go to giftoflifemichigan.org.
Welcome back. We're here with Remonia Chapman. Remonia is the program director for the Gift of Life Minority Organ Transplant Tissue Education Program known as MOTEP. Remonia, let's shift gears a little bit here.
Okay.
Clinical trials. You know, we've learned the hard way in healthcare delivery a lot of times, and clinical trials have really helped us understand various aspects of how we actually get to endpoints in terms of changing disease states in patients. Where's clinical trials being positioned in terms of organ donation?
There are a number of clinical trials of people wanting to do different things with different NIH grants and different things like that. But unfortunately, many times, African Americans do not participate in clinical trials very much. Because again, we don't trust the system. We always believe that sometimes people are trying to, give us things that we don't have.
Tuskegee
the
mentality.
Tuskegee mentality. Henrietta Lacks comes back up, and so as a result of that, we're not trusting. And so what we have been trying to do is in some of our research programs is saying that we need to have more people of color that are participating in those programs. That we need African Americans and Latino Americans being the principal investigators, going out into the communities and talking to people about it. Because once again, the MOTEP model suggests that the more that the messenger mirrors the community, the stronger the involvement, the stronger the ties in that community will be.
Your passion for this issue certainly shows through, and where did that derive from? It's got to be some history behind that. You know?
Well, I believe I started my original journey. I wanted to become a physician, and I kind of got, yes, I did, and I kind of got derailed in that. And so as I was trying to look and trying to find out what my next would be, this opportunity came up. At the time, I was working at Carmano's Cancer Institute in breast and cervical cancer research, and I was not enjoying that and thought that that was a little bit depressing. And I had a friend that happened to ask me, who was the person that brought MOTEP to Michigan, at Gift of Life Michigan, what I considered. He thought that I would be very good, and I was like, you got to be kidding me. And so I decided just to give it a try, and as a result of it, I just again realized that God's plan B was better than my plan A, and it's been an opportunity for one door closing, many doors have opened to help thousands of people, and again, I am just blessed every day.
That's a very inspiring story. How does one become a donor?
Oh, one becomes a donor by going to the Secretary of State's office, letting the clerks know that you want to sign up to become an organ donor, or by going online. You don't have to wait until your driver's license expires. You can go online to www.giftoflifemichigan.org, and you can sign up on the Michigan Organ Donor Registry.
Well, Ramona, thank you for such an insightful presentation to me again in terms of the importance of this subject, and also you should be congratulated on such a job well done in terms of this issue for so many years in the minority community and the larger community also. They benefit from this kind of education just as well as anyone. So thank you, we appreciate you, we love you, keep up the good work, and we will do this again.
Thank you.
Good, my pleasure. Thank you for joining us.
All right, thank you.
We've been talking with Remonia Chapman, the director of Gift of Life Minority Organ Tissue Transplant Education Program, better known as MOTEP. Thank you for joining us today, and we'll see you next time on Primary Care. You can get more information about the show and our guests at primarycare-tv.com and continue the conversation on Facebook and Twitter.